When I first came here about 5 years ago, we saw a big increase starting with patients that were coming in with opioid addiction. And as you know, opioid addiction and opioid deaths have been rising significantly in the country, and no different here in Riverside County. So we saw a lot of women coming in, they're pregnant, they didn't know that there was any treatment available to them. So we actually didn't have one to begin with, and we just started it up because we saw a need.
The perinatal program is for any mother that is pregnant and is struggling with substances. For mothers that are pregnant and also have children, so that they can get the help that they need to change their entire life. Their kids deserve a healthy mom.
I found out about this program when I became pregnant with my third child. You know, this pregnancy was scary. I needed a doctor who knew a little bit about addiction and OBGYN, so I was referred to one of the doctors here at RUHS. Having the stigma of being an addict, I was nervous, I was scared, I felt like everyone was going to be prejudiced and no one was going to give me the correct care I needed.
I was worried that people would tag me as a careless mother. I tried to go to every OBGYN I could. All of them was the same. As soon as they saw my chart and everything, I wouldn't even get to see the doctor. They would honestly give me a look like judging. Made me feel very, very bad. The difference here is it was nothing like that at all.
I think that the big misconception about these women is that people think that just because they are addicted to a substance that they're not worth trying for. I don't believe that. I believe that everybody has issues. Their issue just happens to be substance use. And just because they do have that problem doesn't mean that they don't have the right to change and to be there for their children.
I kind of started sensing this pregnancy was a lot more than just being pregnant with a baby. I knew there was a lot of hope in this pregnancy.
What I loved about Dr. Shiro is that he looked at me straight in the eyes and he said, there is hope. If you want it, we're here. It's not only me, it's a group of team that are willing at your disposal if you want it. We're not here to judge you. We're here to hear you out.
We really are a collaborative environment. We do not judge. We do not care what their backgrounds are. We just want to take care of them because, after all, what most women want is to have a healthy baby.
You know, I love what I do because I'm also a recovering addict. I have 17 years clean and sober. I was pregnant and I did use substances, and I had no idea where to go, and that was 29 years ago. Since then, so much has changed, and if I can do it, if somebody like me can do it, anybody can do it. They just need to be shown how. My advice to anybody that thinks that they can't get help or there's no hope is that there is. Just get here.
While in the program, someone told me that one good decision springs off into a host of many good decisions. And coincidentally, today is the day I take my son home.
I wanted to give up, but because I didn't, I found this program. And I'm very grateful. Because if I did not, I don't think my son would be here today.